Hello friends, I hope you all are doing well and are safe during pandemic. I am Dr. Kulwinder Saini, practicing at 21A Rajguru Nagar, Ludhiana. Today I shall be discussing with you allergic rhinitis and its overview. The word rhinitis refers to inflammation of the nasal passage. This inflammation can cause a variety of annoying symptoms including sneezing, itching, nasal congestion, running nose, and post-nasal drip. Few episodes of rhinitis are usually caused by respiratory tract infections such as viruses, such as the common cold. It can also be caused by allergies to things in the air around you. Chronic rhinitis is usually caused by allergies, but it can also result from overuse of certain drugs, some medical conditions, and other unknown factors. For many people, allergic rhinitis is a lifelong condition that waxes and wanes over time. Fortunately, symptoms can usually be controlled with a combination of environmental measures, medication, and immunotherapy. Who gets allergic rhinitis? Allergic rhinitis affects approximately 20% of people of all ages. The risk of developing allergic rhinitis is much higher in people with asthma or eczema and in people who have a family history of asthma or allergic rhinitis. Allergic rhinitis can begin at any age, although most people first develop symptoms in childhood or young adult. The symptoms are often most severe in children and in people in their 30s and 40s. However, the severity of symptoms tends to vary throughout a person's life. What can cause allergic rhinitis? Allergic rhinitis is caused by a nasal reaction to small airborne particles called allergens. In some people, these particles also cause reactions in the lungs and eyes called asthma and allergic conjunctivitis. The allergic reaction results from activation of two types of inflammatory cells in the body called mast cells and basophils. These cells produce natural chemicals such as histamine, which cause symptoms such as nasal congestion, itching, sneezing, and running nose. Now let us talk of seasonal versus perennial rhinitis. Allergic rhinitis can be seasonal, occurring during specific season, and perennial rhinitis is an allergy which is present throughout the year. Seasonal allergic rhinitis occurs during specific seasons. The allergens that most commonly cause seasonal rhinitis include pollens from trees, grasses, and weeds. The allergens that most commonly cause perennial allergic rhinitis are dust mites, cockroaches, animal dander, and fungi or molds. And perennial rhinitis tends to be most difficult to treat. What makes your symptoms worse? Outdoor allergies. The best way to prevent allergic rhinitis is to avoid the things to which you are allergic. Because allergic rhinitis is caused by outdoor allergies, this can be hard to do. If you have outdoor allergies, there are some things you can do to help it out. Keep your doors and windows shut during pollen season. Use an air conditioner to cool your home instead of coolers or fans that bring in outside air. Consider pollen counts when planning outdoor activities. That may help to limit your outdoor activities when pollen and mold counts are at their highest. Pollens and mold counts can vary throughout the day. Peak times are grass, afternoon and early evening, ragwood, early midday. Molds sometimes peak during warm, dry, windy afternoons. Other types occur at high levels during periods of dampness and rain. Dust mites and live in humid areas. Cover your mattresses and box spring in zippered, dust-proof enclosures. Wash your pillows, sheets, and blankets weekly in hot water at 130-degree temperature because the dust mites will survive in lukewarm water. Animal dander, urine, and saliva from feathered or furry animals are major year-round allergies produced by common pets such as cats, dogs, birds, hamsters, and horses. If you are allergic to animals, do not keep any furry or feather pets in your home. If you must keep the pet, try to keep it outdoors. If the pet comes indoors, make sure it stays out of your bedroom at all times. After exposure to the pet, wash your hands and change your clothes and irritants. Many substances can irritate the nose, throat, or airways. Common irritants include smoke such as tobacco, smoke from wood burning stoves or kerosene stoves and fireplaces, aerosol sprays, strong odors, dust, and air pollution. Reducing exposure to irritants can be very helpful. It is important that no one smokes in a home or a car. Avoid aerosol spray, perfumes, strong cleaning products, and other odor sources in the home. And common symptoms and signs of allergic rhinitis could be: allergic rhinitis vary from person to person. Although the term rhinitis refers only to the nasal symptoms, many people have symptoms that affect the eyes, throat, and ears. Sleep may be disrupted as well. Symptoms may include, like if we talk of nose, there will be watery nasal discharge, blocked nasal passages, sneezing, nasal itching, post-nasal drip, loss of taste, facial pressure or pain. Eyes, itchy red eyes, a feeling of grittiness in the eyes, swelling, and dark coloration of the skin below the eyes called as allergic shiners. Throats and ear, sore throat, hoarse voice, congestion or popping of the ears, itching of the throat or ears. And if we talk during sleep, mouth breathing, frequent awakening, daytime fatigue, trouble during normal activities, that is work. With perennial allergic rhinitis, the predominant symptoms include post-nasal drip, post-nasal congestion, and trouble sleeping. How we can diagnose allergic rhinitis? We as a doctor can diagnose allergic rhinitis by doing a physical examination, reviewing the symptoms. Medical tests can confirm the diagnosis and identify the offending allergens. How to identify the allergens and other triggers? It is often possible to identify the allergens and other triggers that provoke allergic rhinitis by recalling where you were and what were you doing before your symptoms started. For example, spending time outside or around animals. Noting the time of a year during which you have noticed symptoms. Looking closely at the home, work, or school environments for potential allergens. Some physicians may suggest skin pricking test if your symptoms are not well controlled with the medications. And if we talk of medication, antibiotics are rarely required in allergic rhinitis. It is only prescribed when there is a purulent rhinosinusitis. The most common medications are antihistaminics, nasal decongestants, and topical nasal steroids. And sometimes some patients with nasobronchial allergies may require systemic steroids for a short period for controlling the nasobronchial allergy. Thanking you all for tuning in. I hope this video serves some benefit to you.